Hi all, welcome to today's session. Today we are going to discuss about the doctor-patient relationship and the communication ethics. So here in today's session we will focus on why empathetic communication and confidentiality and trust are central to the clinical care and how to apply these principles practically in both the OPD and IPD settings. So we'll move on with the today's session. So as you know, a strong doctor patient relationship is the foundation of an effective care. So when patient trust us, they share information more honestly and follow the treatment plans more reliably and return for the follow up. So communication ethics is not just like an add-on, it is a clinical tool that changes the outcome. So today we'll see the principles and the practical steps, so how to listen and how to protect the privacy and how to break the bad news to the patient and their family, and how to maintain the continuity of the care. So first, we'll see the importance of doctor patient relationship. So why does this relationship matter clinically? First one is trust improves the adherence. So patients who trust their doctor are more likely to take medicines and keep the appointments. Second is accurate diagnosis and depends on the honest history. So without a good rapport with the patients, they may omit. They'll not be able to open up, and they might sometimes skip the symptoms. So that is why honest history taking is very important. Third is long term care. So chronic diseases chronic disease management, rehabilitation and the palliative care, so all depend on an ongoing trusting relationship. So finally, a good communication reduces the misunderstandings and lower the risk. So this is not just like a good behavior, it directly affects the diagnostics, therapy success and the safety of the patients. So that's the importance of doctor patient relationship. Next, we'll talk about the types of doctor patient relationships. So there are practically three models, you'll see. First one is active passive, then guidance cooperation, then is the mutual participation. So active passive occurs in the emergencies, like the clinician decides rapidly and act accordingly in the emergency situations. Second is the guidance cooperation. It is common in routine clinics, like you advise the patient the things to follow and the patient follows that. So that is the common model. Third is the mutual participation. So mutual participation is the aim for most of the chronic and the selective care. So shared decision making, where you present the options, benefits, and the risk of the things, treatment, and the patient's preferences will guide the choices. So this is like an ideal modern approach, so where the doctor and patient share the decision making. So this by recognizing which model fits the clinical situation and adapt your communication style to it accordingly. So that's the thing about the types of doctor patient relationship. Next comes the ethical principles in communication. So what are the ethical principles in communication? There are four ethical principles which will guide our conversations. First one is autonomy. It is like respect the patient's right to make the informed choices. Second is the beneficence. So act in the patient's best interest. To always act like according to the patient's interest. Next, the non-maleficence. So do not harm through words or actions. Avoid something which includes like avoid misleading in information or with the frightening language and all. Don't use such things. Last one is justice. So be fair and avoid any kind of discrimination among the patients. So there should be equal treatment for all type of patients. So apply these together. For example, autonomy and beneficence may conflict. So you must explain the risk clearly, but still respect the patient's choice. So this is how, like, according, if you know these ethical principles, you should be knowing how to implement these principles while the in your OPD and IPD when you communicate with the patient. Next is the empathetic communication. So, empathy is a skill, not just feeling. So, start with active listening. Let the patient speak uninterrupted for the first 60 to 90 seconds. Use open body language and appropriate eye contact. Avoid any difficult words, like translate the medical terms into everyday language, and also validate the emotions, patient's feelings. So I can see, for example, I can see this, this is worrying for you. So use like, I understand this must be difficult for you. Use such words this. So use brief summaries to check the understanding. So finally, allow silence when needed. Patients often collect their thoughts during a pause. So these small behaviors will increase the disclosure and the adherence. So always have a empathy towards the patient during your conversation. Next is the confidentiality and privacy. So, confidentiality is fundamental. So, treat all the patient information as a private unless the patient's consents to sharing or the law mandates disclosure. In such cases, you can do, and use private spaces for sensitive discussions, and be careful with phone calls, text, and social media. So, when discussing cases with the colleagues, anonymize the details unless team care requires otherwise, and document the consent decisions clearly in the notes. And remember, preserving privacy is also preserves the trust. So a breach can destroy the doctor patient relationship. So always have a confidentiality regarding your patient, and have a privacy. Next is a handling difficult conversation. So how we'll be handling difficult conversation, or like bad news, prognosis, errors, and all. It requires a structure. So use this spikes framework, like for a S for setting. So setting, ensure privacy and involve the family if the patient wants. Second is perception. Perception is ask what the patient currently understands. Next is invitation. Invitation means find out how much detail they want, no, like how much detailed explanation they need and all. Next is the knowledge. Knowledge is give information in small things, like avoid any blunt language. Check the like the way you speak should be in a simpler and a more understandable way. Next is the empathy. Empathy means respond to emotions with the validating statements. And last is summary and plan. So end with a clear next step. So what you can do next, what are the things you can see do forward. So practice this structure. So it reduces the clinicians it reduces the art stress, and it will also helps to patients to cope up with it. So this is how you can handle any kind of difficult conversations when you have with the patient, or any even if the patient's family also. Next comes the building long term trust. So, trust builds through consistency. So, be punctual where possible, follow up on promises, and communicate changes proactively. So, if an error occurs, acknowledge it, apologize for that, and explain the next steps. So, transparency preserves trust better than the concealment. So, and try to ensure patients see the same clinician or team for a chronic conditions. So use patient centered language, as I've mentioned. So we will work together to, or like you must do such things, or like rather than like only giving things to the patient, you should be like a teamwork. You should, when you talk, you should be like, we both can discuss and do it together. Like that you can talk to the patient. So it will help that patient is not it will make the patient feel that they are not alone, we are working with them. So these are small acts. So remember these key concerns, and that will matters a lot to the patient. Coming to the clinical relevance, OPD and IPD. So now in clinically, how we can, like how these are implemented in OPD. Start with the like how you can deal the patients in OPD and IPD management. So in OPD, start with a welcoming greeting, allow an uninterrupted history for the first minute, then use a focused questioning, and explain the diagnosis, and plan the treatment plans, and discuss options with risk and benefits, and obtain the informed consent for the procedure. So give a clear written instructions, and arrange the timely follow up. So document all these conversations of the patients, and also as well as the patient's preferences. So this is what you can do in the OPD. Coming to the IPD, Communication expands to the families and multidisciplinary teams. So hold a family meetings for any such major decisions. Schedule the regular updates and coordinate with the nursing and allied staff to ensure the consistent messages. Use a bedside communication for daily goals. So who is responsible for medicines, investigations, and mobilization. For critical events, involve the patient if possible, and family. Use the spikes which I have mentioned in the previous slide, spikes things for serious news, and ensure the clear discharge planning with written and verbal instructions. So that is how you can deal the patient in the IPD. So let's have a quick summary of today's session. So the doctor patient relationship is built on a trust, empathy, and confidentiality. Communication is the key. So it directly influences the diagnosis and the patient safety. So use a structured approaches whenever you speak to or talk to the patient and as well as the patient's family, and also adapt your style to the clinical settings, OPD versus IPD. So these are the things you can implement in your daily clinical things whenever you deal with the patient. So that's it for today's session, and I hope you got a clear idea regarding doctor patient relationship and communication thing. So thank you so much. Have a nice day.